All right. It's an exciting time, y'all. So thank you for being here. We're going to cover some really good information, have Jackie Leifert, who is one of our strongest allies in this movement. We get to hear from today, who's taught me a lot as a health center advocate. And so I think it's going to be a really, really great time for everybody who's here. Just want to give a couple more seconds for folks that are joining. One thing, as we get started, we'd ask that you put the questions in the Q&A section. We do want to have time to ask questions, and we certainly will at the end. We're going to save questions until the very end, because it is likely that Jackie will cover questions that you have by the end, and if not, we'll have time to revisit some of those and get clarity if that's what would be beneficial for you.
I think you can go ahead and get started, Susan. It's slowed down with entrance.
Great, great. All right. So May, let's go to the next slide. Okay, y'all, if you have not heard from us yet, we're going to find you, because we really want to make sure that every single person who is invested in community health centers knows that right now we've got to make a massive push. The time is indeed now. We have a great opportunity ahead of us. And it's changed a little bit since yesterday and today, but the news is that in this very divided Congress, there's been a decision made that the House would consider suspending the rules where amendments are necessary if they can get 2/3 of the House to vote for the legislation, vote yes on the legislation that gives community health centers funding. That is a huge deal, y'all. And it's really important that we get 2/3 of Congress, the House, to vote yes, because there's so many different amendments that could be offered that could shut down this bill, and we don't want that to happen because we want this funding to get through. So there's a QR code at the top that you can scan. Sarah's going to put the bit.ly link in the chat. Every single person you know who loves you, who loves your health center, we would love for you to ask them to take action. And if they don't know why, there are resources here to share that. So sometimes there are questions about what health centers can do in terms of advocacy, and there's fear about partisanship and all kinds of stuff. And so I checked with Jackie ahead of time, and in good keeping, the things that we have here on this slide are things that you and your health center colleagues, leadership, staff, board members, patients can absolutely do. We would not be encouraging you to do this if it wasn't legal. So today there's an action alert that went out. It went out yesterday in the Washington Update. We hope that you've had a chance to take action. If you haven't, hope that you will, and forward this QR code to your colleagues. Every single day on social media, we are going to have messages about health centers and the value that health centers bring to all of our communities that you can then retweet and quote and tag your members of Congress in. I was talking today about if you were having a screening for diabetes and you have posted it on your social media, you can tag your member of Congress to let them know that you're doing that. Every time they see your health center pop up in their feed on their page, they are reminded of how important you are to every single one of their constituents. And so we want to use social media as much as we can to get to as many of their staff and as many of the members themselves as possible. One additional social media post that just went up, Mark Stewart from Delaware Valley Health Center has a challenge, a goal set for his health center of 150 staff today taking action and a total of 300 by the end of the week. He is posing that challenge to all health centers across the movement. And so you will find that challenge and link on Twitter and Facebook. Would love for you. I'm just curious how many health centers are going to be up for that challenge. I hope everybody is, given how many people we are serving and working to protect that access to service, access to care. And then the last thing is in the next couple of weeks, after you have a chance to talk with Jackie, hear from Jackie about what is doable, and to make sure that we can get as much buy-in as possible from your colleagues in the communications or fund development teams, to do a Twitter chat where we are amplifying all of the work and all the reasons why health centers need to be involved. So Jackie, it would be great to hear, when I put these up on the screen, I know you're going to talk about it in depth later, but for everyone to hear in this moment as they're looking at these actions that people can take, are these permissible?
So, so Susan and I had the wonderful opportunity way back last January of working with a group of health center leaders, many of whom were skeptical that Jackie Leifer would ever get up on a podium and say, absolutely legal, do it. And boy, weren't they surprised when indeed I confirmed lobbying, advocacy, education, nonpartisan activities, information sharing, perfectly permissible. We will talk about some of the cautions when it comes to political activities, very different issue, but we are going to keep using this mantra. Lobbying is permissible. I had the whole room of health center leaders shrieking it out by the end of that session.
Yes,
so,
you did.
Susan, yes, these are all legally permissible activities. And the only thing I ask of you is that you remain part of your health center team in terms of what messaging you're giving and remaining consistent with NAC's messaging to you and your primary care associations messaging to you so that the advocacy we're doing is most effective. We need to speak with one voice.
Absolutely. May, let's go to the next slide. Thank you, Jackie.
So as I just said, legislative advocacy, perfectly permissible. You're going to get sick of me saying permissible, permissible, permissible. Again, don't fall over in shock. But you may not use federal grant funds to support the costs associated with advocacy. And one more caution I do want to give, if any of you are with public entity health centers or receive grants from other agencies, do double check that there are no restrictions associated with your work for a public entity. In this regard, be mindful of the Hatch Act. And I'm not going to get into detail because so few of you are with public entities, and we could talk about that separately. But for the rest of you that work for or with private nonprofit health centers, advocacy is permissible. Don't use federal funds to cover that cost. What is absolutely not permissible is engagement in political campaign activities. Your health center could lose its tax-exempt status, and the vast majority of health centers are 501c3 tax-exempt organizations. And so you have to be extraordinarily careful with respect to political activities, never to use the health center's name, resources, phones, fax machines, anything in connection with partisan political campaign activity. And we'll get into more details later. But bottom line, as I said, lobbying, your efforts to impact the enactment, amendment, and or repeal of legislation, permissible. Next slide, please. And forgive me, I have allergies, so I have a cough drop. I hope you don't hear it clicking. All right, so what is advocacy? I don't have to read slides to you, but the key here is that you're working on legislation, either directly, that is contacting members of Congress or at the state capitol yourself, or grassroots lobbying. You're asking neighbors, family, et cetera, to join you in reaching out to legislators. Susan, do you want to add anything here? Because I know we're eager to get all troops out.
We absolutely are. So, Jackie, I think what you're reminding us is that our being cheerleaders for health centers and are encouraging people to step up and stand up for health centers at critical times. And we alert folks, and your state associations alert folks, primary care associations alert folks is really important. And I think that sometimes we think about advocacy as something that's transactional, that NAC or your primary care association sends an action and says, now's the time to stand up. And we absolutely will do that. We will send alerts at times like right now, times like these that are urgent. The other part about advocacy that's important to me is that every time we are somewhere where there may be someone who's invested in our health center, an elected official, whether they're local, state, county, that we are speaking to them saying, this matters to me, that advocacy really is a way of life. It's a way of being. I was volunteering with my daughter's Girl Scout troop at Mary Center on Saturday. And so I learned that one of our council members had introduced legislation to expand Medicaid to cover home health services costs, Jackie. And so I just right there took a video of myself with the Mary Center logo in the back and said thank you to that member of Congress and posted on my social media feed and tagged her. So to me, advocacy is not just these calls to action like we're doing right now, but it is about building community, encouraging other people to join us and standing up for 31.5 million patients.
Absolutely. And, I'm sure everyone on this webinar is, familiar with the many walks of life and community that we get an opportunity to brag about the amazing work that we are doing, and never feel shy about that. That you never know when that other person will have an opportunity to advocate on our collective behalf. And there are many times I've educated friends in so many different places about health centers. Gee, what's a health center? Oh my gosh, my daughter is going to college and doesn't know where to make an appointment with a clinician. And I immediately, literally look it up and tell her where the nearest health center is. So we have so many ways and so many opportunities on a day-to-day basis to advocate.
Jackie, just one more thing, because I imagine that there's some people here saying, well, Jackie's an attorney. She knows the law backwards and forwards. I'm not an attorney, but I do this is my full-time job. So I get to be here and know and spend time talking with you and learning from you. Sometimes people can be nervous about advocating because they feel like they have to be an expert about health centers. And my experience, our story is as much expertise as we need, right? Because we're talking about our experience with the health center and why we value the health center. The parameters, the legal guidance is what we need to be aware of. But in terms of how to advocate and what we say to those decision makers really is very personal.
Well, and stories are everything. For those of you that have ever come to my incredibly boring legal trainings, you know that the way I keep you awake is by telling you the stories, whether it's worst case scenarios or best case scenarios. Legislators learn by stories as well. That's what they'll remember. They're not going to remember necessarily that you're asking for 4.2 billion versus 4.3 billion, although you do want to go in armed with the factual information. But it's the stories that really stick with them. Just don't use patient names and identifying information.
Thank you for beating that legal guidance all the time, Jackie.
All the time.
Let's go to the next slide, mate.
So here are those technical definitions. And again, in neon lights, permissible, permissible, permissible. Advocating for the enactment, amendment, or defeat of pending or proposed federal, state, or local legislation. Now, this says it includes referenda and ballot measures. The only caution I would give you is that referenda can be slightly partisan or political in nature and may have to be reviewed, case by case, just to be absolutely sure. But as a general matter, referenda and ballot measures also under the rubric of lobbying. Lobbying does not include actions by the executive, judicial, or administrative bodies. So when you are advocating to HRSA for That is not legislative lobbying. And today we're really focused on that, on legislative lobbying. By the way, providing objective, educational, nonpartisan information isn't even lobbying unless you attach to it a message. So you've just told the congressperson all about your health center, the incredible things you've done in the past year. And then at the end you say, therefore, please support Senate Bill 123. Now you've made it a lobbying communication. And this is where I get to remind you, that's okay. Lobbying is permissible. The reason, though, that it matters, because you might be saying to yourself, well, then why do I even care whether it's pure education information exchange versus lobbying? Remember that you can't use grant funds to support the cost of the effort. So you do, and we'll be giving you some tips in a few minutes, but you do want to keep track of the associated costs, whether it's the Uber up to the hill or it's the time spent. If you have a full-time job working for the health center, the time that is spent in that advocacy session needs to be accounted for, and you need to be able to show that you're not using grant funds. By the way, your health center is required to tell the federal government how it's going to use federal grant money versus program income. Program income defined as fees, premiums, third-party reimbursement, state, local, and other operational funding, Medicare, Medicaid, et cetera, patient fees. You have to say to the federal government when you apply for the funds, I'm going to use your dollars, so the blue dollars for ABC, and I'm going to use the red dollars, program income, for DEF. You can't say you'll use the blue dollars for any lobbying efforts, and you need to be able to account for how you use the red dollars, because under the statute that authorizes the health center grant program, program income is very specifically regulated. And when I say regulated, you automatically think, uh-oh, restrictive. No, we actually have more flexibility than most grantees to spend program income in furtherance of project objectives. Well, advocating for more funding for health centers is certainly in furtherance of project objectives. So again, being able to account for where the blue dollars are applied versus your more flexible red dollars, extremely important. Next slide, please. As I said, you can engage in both direct communications with legislators and or their staff. But there's also grassroots lobbying, again, perfectly permissible, communicating with members of your community and asking them to help advocate in support of the health center. Anything you want to add here, Susan?
I don't think so. I think one example of this would be if you are your chief medical officer makes a call directly on behalf of your health center to the member of Congress to say, we really need you to pass the vote yes on this funding in the House bill early next week. That would be direct, because they're having a direct conversation with that member. If you, as an advocacy lead at your health center, send a call to action to all the people in your health center and your patients and board members who've signed up to be advocates or are in your health center today and you want to engage them today to advocate, that would be a call to action. So that's, I think that's, Jackie, I think this is just an example of the difference.
Perfect example.
And
Next
so,
slide. Oops,
yeah.
sorry.
No, please, let's go.
Next slide. Next slide. Thank you. All right, let's go to political campaign activities. So activities in support or opposition of candidates for elective office, absolutely prohibited. The health center could lose tax exempt status. There are excise taxes that can be imposed, not to mention a cost as allowance associated with any use of grant funds. Now, in this regard, let me remind you, if you didn't know already, you have First Amendment rights. So as individuals, you can lobby to your heart's content, you can engage in political activities to your heart's content, but with respect to political campaign activities, you cannot in any way connect yourself to the health center. So this is an area where, violating the prohibition has such serious consequences that you want to behave very conservatively. And the example I always like to give is, when does your favorite legislator call you to come do a tour of the health center? Almost without fail. I'm going to answer that for you. It's 2 weeks before the election or the primary. And you never want to offend your favorite legislator, or maybe it's not your favorite legislator, but you're hoping to turn them around. You have a couple of options. Number one, you can say, we're a 501c3 tax-exempt organization. We cannot do anything that implies we are connected to your political campaign. Would you please call us back 2 weeks after the election? That's one option. Option number two is to say, we'd love to have you, but we will have to invite all candidates because we are strictly nonpartisan. Not my favorite option, because the fact is that there's always somebody ready for you youngsters. You won't know what I'm talking about, but that's okay. Ready to drop the dime on you. There's always an opponent who just relishes the prospect of letting the FEC and the IRS know that your health center is violating the political campaign prohibition. So my favorite option is the, love you madly, but really can't we wait until a couple of weeks after the election? And the other, that you would truly make it nonpartisan and invite candidates. The other thing to consider is saying, we'd love to meet with you. We just really can't do it at the health center facility, cannot be using health center resources. How about the community center downtown? We'll bring staff that might want to have the opportunity to meet with you. And again, not because this health center supports your campaign, but because they would like to simply meet with you and talk with you about the issues. Again, be careful. Next slide. So definition here, political campaign activities, participating or intervening in political campaigns for a candidate in an election for public office. And here are the kinds of examples that come up all the time in terms of the political campaign no-nos. So take a look through these. Next slide. So threading the needle, because there, again, can be a pretty close intersection between, excuse me, taking position on policy issues, including those that can divide candidates in elections, and keeping it nonpartisan. Keep in mind that in evaluating in a close call whether your activity was political in nature or legislative advocacy, here's what would be evaluated. Does your statement, and now we're talking about a health center statement, identify candidates as opposed to legislators? Does the statement express approval or disapproval for a candidate position? And you can see how this could get gray area the closer you get to primaries and elections. Does the statement refer to the election or voting? And as I have said now a couple of times, what's the timing of your statement? Is it close in time to scheduled action on legislation, or is it related to an electoral event? So look at the IRS ruling here. 501c3 organizations can take positions on public policy issues, even if it divides candidates in election for public office, but you have to avoid advocacy that as political campaign intervention. And so again, as you think about the statements you're making, to me, the easiest assessment is, in mid-season, as opposed to the closer and closer you get to an election. As you get closer, you really want to look at these factors to make sure that you're keeping your statements nonpartisan, informational, educational, and or legislative in nature. Next slide. Best practices in this area. Excuse me. So we strongly suggest you have written policies for staff, and folks often forget about volunteers. Treat volunteers as if they are your staff, because when they hold themselves out to your legislators and to the public, they are associating themselves with your health center. Your written policies should cover workplace activity, what is permissible, what isn't permissible. So let's revisit. Lobbying is permissible.
Permissible.
Thank you. Education, nonpartisan information is
Permissible.
The kinds of social media contacts that Susan shared with you at the beginning, permissible. And here we're even going to give you a tip that as I talk to you about accounting for lobbying activities so as to be able to show that you're not using grant funds to support the cost, policies which call for the employee to take a scheduled break for advocacy activities if 330 funding or other grants pay for that position directly or indirectly. Our view, jump to number 3 here, is if you could allocate a very small percentage of every employee's time, volunteers, this is not relevant, you're not paying them, but for staff, if you allocated just a tiny percentage of their time to be covered with non-grant funds, it would be that much easier to document an available source of non-grant dollars to cover the associated cost. Also useful to have a board resolution, which reflects the board's commitment on behalf of itself and the entire health center to advocacy efforts in support of the health center's stability and growth in meeting the needs of the community. Anything to add here, Susan?
I don't think so. There are a number of questions that folks have in the question and answer that we'll speak to them. We'll get to some more details, but I think now let's keep going and then we can go back to the question.
Sure. Next slide, please. All right. So here are some resources on advocacy and election for you. And I think some of these are available through NAC, right?
They are. Yeah.
Yay.
And this, Jackie, this document here is one that
we created. Yep.
Right. It's very comprehensive.
Next slide. All right. So the do's and the don'ts. Engage all candidates if you're going to get involved in any way in political activities. Stay nonpartisan at all times. Host candidate forums as opposed to individual candidates. Who always arrange for publicity, by the way. I love to tell the story of Mrs. Clinton timing her announcement of her first run with a speech she was going to be giving at a health center on the reauthorization of the child health insurance program, and having the opportunity to talk to her handlers, I love that word, her handlers, about how important it was that she not make her announcement at the health center, and the implications of her doing so. Her handler said, I'm quoting here, "You think we can handle Mrs. Clinton?" And I said, "You have to assure me that she won't be making a political announcement." They said, "All right, we'll make the point." And she did wait until she was about 20 steps down the sidewalk. And in the New York Times front page article, you could see the word center, but you couldn't see anything else, thank God, when they were writing up her announcement to run. All right. Do engage legislators, whether candidates or not, on the health center program. We still find ourselves the best kept secret ever. Just when we think everybody knows who we are, you're going to run into a legislator who says, "What? Health centers? Who?" Interact with social media profiles and get involved with voter registration. Voter registration, perfectly permissible as long as it is nonpartisan. The don'ts: don't support one candidate over another. Don't engage in any campaign activity with reference to the health center, with using health center resources, whether it's the facility, the paper clips, telephones, computers, anything, nothing. Don't interact with candidates' campaign accounts on social media, and don't tell your patients who to vote for, no matter what. You can ask your patients to advocate to legislators, and should, but do not get involved in the political campaign aspect. Next slide. So, voter registration, again, perfectly permissible as long as it's nonpartisan. Make sure that the costs are not being paid for by federal or state funding. The health center can actually serve as a polling location and can educate voters on issues, but do not encourage a voter in any respect to vote one way or another. And we've talked about hosting elected officials at the health center. By the way, I haven't addressed any of the specifics for primary care associations. We've had separate conversations with the primary care associations in terms of IRS expenditure limitations and so on. Those simply don't apply to health centers generally. So that would be a separate conversation. But for PCAs that are 501c3 organizations, the general principles we have just thus far talked about would apply. Next slide. So in voter registration, this is to me the most important qualification. You can focus on registering in areas where there are historically oppressed and repressed populations. You cannot focus on ideological groups, so liberals versus conservatives. You can choose a geographic area because it has historically low voter turnout, but you can't focus on an area because it has such a close race. Next slide. So here are your links to more information. Take it away, Susan.
All right. So Jackie, there are a number of questions in the chat box.
And are you all going to
I am going to
translate
read
them
them
for
out.
me since I haven't been
I
able to
am.
walk
I
through
am.
them all?
I just had a puppy walk back in the house. I was trying to make sure that there was no added noise. So the first question, and I think you've gotten to this, but I think a more specific answer may be helpful. Are FQH staff members permitted to do these activities on the clock, or does it need to be done on a staff member's own time?
So advocacy activities can be done on the clock if the clock isn't being paid for with federal grant funds or another source of funding that is restrictive on lobbying. And that's why we were saying that it might be helpful to actually allocate a small percentage of every staff member to program income, because program income with respect to advocacy efforts is a more flexible source that is not similarly restricted.
Right. And so one question, sometimes we've recommended that people set up a break room or something special for staff so that when they go in there on their breaks, they can take action.
Sure.
Okay. So something like this. So there are creative ways to do it. So it doesn't have to be after work when people go home and are thinking about the busyness.
No, lobbying can occur within the four walls of the health center. The key here, though, is an accounting measure and being able to show that it is either on the person's own time or otherwise that it is not paid for with federal grant dollars is an accounting measure that you want to make sure your CFO is familiar with. And, there are many health centers that decided when it became crystal clear that you were going to have to tell the federal government what you use their dollars for versus program income. Many health centers decided we're going to throw all staff costs into the pot for the federal grant, and that way we won't have to micromanage all of our other expenditures. But here's an area where reserving a small percentage to be off the federal dime is a good idea, because it will make it a lot easier for you to demonstrate, if you were ever pressed, that you had adequate non-federal sources to cover that expense. And you never said to the federal government, I am covering 100% of that person's time with federal funds.
Great. Another question here is, are there reporting requirements for advocacy efforts? You've touched on that a little bit, but want to make sure that if there's anything specific that you want folks to ask.
So there are different reporting requirements for different purposes. For example, your grant award carries with it the Byrd Amendment, which dates back probably now 35 years. Senator Byrd got very annoyed that one of the universities down there was using federal grant money to lobby for more federal grant money. And that resulted in legislation, the Byrd Amendment, which requires reporting on lobbying efforts, very specific types of lobbying efforts with very specific lobbying thresholds. Here's an area where I would refer you to our additional resources and to your grant award specifically, because it's really off topic for today, but there are reporting requirements there. The accounting is a reporting requirement if pressed. In other words, if your auditor or an independent auditor or the inspector general were testing the allowability of your grant expenditures, the accounting for the advocacy effort with support for the claim that it's program income supported would be important.
Great, great. Another question here is, see if I can combine some. Another question here is, would you suggest creating a budget for lobbying?
I'm always a fan of budgets, because then the board is fully aware of the commitment that's being made and just how important advocacy is to the organization. But make sure everyone understands, which comes up in so many different dimensions, that budgets are simply a snapshot in time and that there needs to be flexibility. So here we are at a critical stage with respect to health center funding. We would have hoped we wouldn't be, up against the wall yet again. And it may be that you are, applying much more staff effort than you have had to, and that you anticipated 9 months ago when you got the budget approved. So good idea to have a budget, bad idea to feel you must stick to it. And that includes a conversation with your board.
Awesome. Thank you, Jackie. So one question here, and I'm going to try to move these a little bit faster because we have a number, which is awesome. Is it okay for a staff person to send out an action alert to health center staff if they haven't formally signed up to be advocates?
That's a really good question. So I would argue that sending something just generally or posting it is okay, but be careful that it never appears that you are putting pressure on people. It's a be careful, and especially if it's coming from the C-suite. You just don't want people to feel their jobs are in jeopardy if they don't become an advocate in the first place, or they don't take action, they don't do something. And, given the ability these days to track whether people actually do press the button or don't press the button, it really is an area to be careful. You can encourage people. There cannot be consequences for people deciding they have other more important things to do, even though we can't imagine anything more important than this.
Jackie, some health centers are creating contests and having fun things like your free dress day and that sort of thing for folks who do take action. Having fun with it where it's voluntary is.
So I'm fine with have fun with it, but find ways to communicate this is strictly voluntary. And I would actually put that in big, bold letters. This is strictly voluntary. There is no requirement that you sign up.
Yeah, great. Okay, so here's another one. My board president wants to meet with a congresswoman who has declared a candidacy for Senate to get her to know us early on. We are not in her congressional district. I recommended we not meet with her unless we're also meeting with other candidates. I don't know if she understood. What's the best way to explain this? Was I right to say no?
So I worry a little bit about whether or not the board has been adequately trained. I mean, one of the reasons we're doing this webinar is actually so that you will be able to train others as well. And so making sure the board member understands the consequences to the health center. She walks in, she says, I'm the board chair of Healthy Communities Health Center, and we are thrilled that you're running for office. And by the way, I want to tell you about our health center and we need you to vote for ABC. Everything was fine, except, this would be a quiz question, except we're thrilled you're running for. And it's the little things like that that wind up getting us in trouble. So what I would say is better to meet with all, and better to make sure you've provided training to board members and regularly update that training, so that in communications, not only are they aware of lines that should be crossed or shouldn't be crossed, but they're also staying part of the team. I worry about that as well. That's not so much a legal issue, although it truly can become a legal issue if a board member wanders into political campaign activity gray area. So training is really important, and having agreed upon health center positions critically important.
Well, that's one of the things, Jackie, that we talk a lot about too with board governance and the engagement of board members and staff and what that looks like. another reason when Jackie talked about the importance of a board resolution, because one of the things in the sample board resolution that we have, the template that we have, talks about the commitment that the board has with the CEO to make sure that everyone's in line with what the role of that advocacy is going to be, what that's going to look like.
Perfect.
Let's see. So then another question about what board members could do in advocacy. You just talked about that. I think my thinking, Jackie, is to go back to that it must be bipartisan, and we're not endorsing any particular person nor candidate when in those conversations. Or is that a simple way to do that?
Absolutely. Stick to information, education, advocacy for legislation, no positions, nothing linking the health center to endorsements and support for candidacies.
Great. There are a few questions here around political candidates and electoral politics. And so we talked, there's some slides about voter registration, and we have partnered with Vote ER, and they've created a whole section of their, and Sarah, if you put that in the chat, that would be great. Vote ER has created a whole section of their website with Feldsman Tucker, Leiper Idell, for health centers specifically because of $330. So that is a question around voter registration. We encourage you to go there. They've been great to work with and are working with health centers specifically, so are very familiar with the 330 grant and the different considerations we have to take into different things we have to consider. Another person asked about informational political candidate forum. And I think when we think about that, I think how we phrase it matters, Jackie, that it could be a town hall on issues related to healthcare. It could be a town hall on issues related to social drivers of health, but to get candidates to weigh in. My sense, Jackie, is that what's important with those, again, is what you've said already, is that all candidates be invited to attend.
Absolutely.
And that there is absolutely no endorsement of a particular party, nor denunciation of a party, nor a candidate.
Absolutely. Those are the key items, that it's strictly nonpartisan. Great.
And then we've got a question about a template for policy that we can share, and we will work in on getting that to you all. Oh, this is a good one. Can a candidate for office indicate that he or she is an employee of a health center and list that health center by name in their bio campaign materials?
So it is a fact. You know, if someone is employed by the health center or on the board of the health center, that is a factual statement. What they may not do is say anything that suggests that the health center supports their campaign effort.
Okay. And then one person is asking about being the subject of attacks by a certain political party and a state legislature. I think that would be something for us to talk about offline. I don't want to ignore that question because that's definitely troubling given how much good work y'all do. Yeah, so if an elected official, and so this, I love this question, Jackie, because I want to expand on it a little bit. If an elected official visits a health center and posts on social media about it, not as a campaign ad, can we reshare that post? Yes.
So I hate to admit that I am not a social media expert. Diane Pledgy on my team would be able to give you a more definitive response. I'm always in favor of getting consent, but I don't want to tell you that that's legally required. You know, the law is emerging as we speak in terms of social media and your ability to repost and so on. So I am ducking simply because I don't want to give you the final word. I don't have the final word on that.
So Jackie, we've checked that out with Diane. It is
indeed
accessible. We have even been encouraging folks to tag their members of Congress on their own posts so they show up in the social media feed. So that is a way that we found we can get into the get in front of lawmakers in real time. And again, it's important that they be their official social media in their office, those accounts, not their campaign accounts. That matters a lot because you don't want to be seen as endorsing. But if they visit you, They would love for you to post that they've been there with you. And the other thing we saw recently during National Health Center Week is we saw a number of elected officials starting a conversation with the social media person, thanking them for the work they're doing at their health center. And it was a really inspiring way for the staff to see the lawmakers supporting what they're doing.
Well, and having said that you consulted with Diane about what's permissible, you have now heard what's permissible.
Let's see what else. Could health centers lobby for policies at the federal level that are outlawed by their state? For example, could a health center in Florida lobby for federal protection of gender affirming healthcare for transgender youth?
Ooh. I think I would want to see your state law. You know, as we know from the some of the clever approaches that have been taken in some states around abortions, making it a crime in the state to do things out of state. I'd really need to see the actual law to give you comfort or not in terms of how you proceed. That would be very state law specific.
Okay, so I'm going through these last questions, Jackie, just because we are running out of time, and
Sure.
I want to make sure that we that I'm getting to everything on here. Right. So if a staff person sends an automated email to their elected officials and they choose to participate, they still need to you still need to make sure they're sending at a time when they are not on the clock, unless you know that your CFO has booked some of all staff time on non-grant funds.
Correct. That is the
So you could set up a computer in a lunch break in a lunchroom. You could have people have access to their cell phones and the lunch.
And by the way, doing it that way is a wonderful way to be able to prove that you understood what the law was and you're abiding by it. So yes, those are great ideas.
So one question, there's no reasonable scenario to get a legislator to meet at our site simultaneously running for office. You know, I think Jackie already laid that out, that there is some risk, and that's part of what lawyers are here to share with us, right? That there are risks that person would use that visit as a way as a campaign stop to demonstrate that you are supporting and endorsing their candidacy. There are lots of things you can do, such as ask your staff not to pose for photos with their logo and pictures with the elected officials. You could have them take a tour of the site when it's not open. There are a number of things that you can do to minimize the risk, because we know folks are using all different kinds of ways to connect with people. And certainly during National Health Center Week, there were folks that had already declared their candidacy. I think what Jackie's naming is the importance of understanding the risk and then making decisions from there about how to mitigate that risk, and if you even want to consider that risk.
Including inviting the other candidates as well.
Yes, thank you for that. They had asked that in their question. Let's see. I think the other thing, there are so many questions, really good questions here, and we're not going to get to all of them. I do want to, May, can you take us back to the second slide, please? Just to remind folks who joined late. Sorry, the one before that. Yeah. So this is the call to action. The QR code will take you there. These are the different resources and different ways that we're asking you to consider engaging with your elected officials and bringing people into that conversation. The most important things that you've heard Jackie say, and again, Jackie, I'm very clear about this, that Jackie's not going to limit this conversation to one or two most important things, because there is a lot that we need to pay attention to. And so thank you, Jackie, for that. I think one of the things that you can encourage staff to do, you can encourage one another to do, and you can consistently ask in your questions of yourself as you begin to advocate is this nonpartisan? Right? So if I say X, Y, or Z, does it say that I implicitly support that candidate or that political party? So if you are taking one of the social media messages that we post about how wonderful health centers are and what they do, how many children we've served, right, in 2022, and you tag Senator Tillis and Senator Burke, because you're from North Carolina. That is permissible, and it doesn't mean that you support only Republicans. It doesn't mean that you support only those two senators if they're running for re-election, right? What it means is that you are saying to people that are representing you in this time, who are going to make decisions that impact your health centers, that you're reminding them that you are important to them and their constituents. So I think that's really important. So you could tag and again, thinking about what the message is and how you want to send that. Who are the people? What are the things in your health center that you're proud of? I see so many really cool and creative videos that your development team is sending out. Those are the perfect kind of messages to make sure you get in the social media feed or the inbox of your legislators. And we say social media feed because there are lots of emails. Social media shows up right there. A couple of things too is that you can thank the members. We have bipartisan support from Congress. So there are lots of ways that you can include a thank you to the member in these messages. We're able to do this work because of our partnership with Congress for the last 50 years. So we encourage you to think creatively. If you have questions for us, please let us know. Jackie, I don't know if you have any final words for us before we wrap up.
Just do it.
Thank you, Jackie. Thank you, everybody here, for being with us. There is that challenge that's posed today from Delaware Valley. And so we hope that you'll take that up and engage your colleagues. The other thing to remember, just the last thing I'll say, is that we want to build communities we're advocating. We don't want to just send out action alerts. So I think the opportunity to ask your colleagues if they consider taking action, right, that invitation where it's not mandatory, you're reinforcing that, is a way to help them connect to the mission. So why are you taking action, and why is it important to you that you speak up for health centers? Might be an interesting way for other people to think about why they want to do that as well. Thank you all so much for being with us. Please let us know if there's anything we can do to support you in this effort. Bye-bye, y'all.